All right. How's everybody? Welcome to your second week. Or now, I'm going to dive right in here because I always just kind of feel clumsy when I do off the top of my head introductory remarks. So be sure to check this week's announcement post to get your general bearings and perhaps go to the detailed course outline on the syllabus as well if you have any confusion about when assignments are due and that sort of thing, and what the agenda is for the week. All right, so you can think of this set of reading questions and this lecture as being complementary to last week's lecture and questions. Here, we will be diving back into ethics at the theoretical level. The main difference is that we will be focusing much of our attention on specific principles which have a large role in medical ethics in particular. I have in mind the principles of autonomy, beneficence, utility, and justice. We will also be reiterating some thoughts from last week. The principle of utility once again makes an appearance, as does Vaughan's moral realism, and I think hopefully you'll recognize some kinship at least between Kant's principles and the principles of justice, which we'll be discussing. There is an important distinction. I think I skipped a slide. Here we go. So there's an important distinction, which we'll start off with, between statements which merely describe how the world is and statements which evaluate features of the world by either making judgments of various sorts or making a statement of how people ought to behave. The former type of statements are called descriptive, and the latter type is called normative. Descriptive statements are made by a variety of theorists. The physicists, who states that the world is composed of atoms, is merely describing how the world is. Similarly, an anthropologist who reports that women are not allowed to vote in a specific country is simply reporting how things are done in that country. In contrast, the social reformer, who states that women ought to be allowed to vote, is making a normative statement. Now, ethical statements are normative. When one makes an ethical statement, one is typically passing judgment on someone's behavior by applauding or condemning it, or is stating that something, such as either human life or animal life, has value. Even though ethical statements are normative, they are not the only type of normative statement. Vaughan lists several other types. Aesthetic judgments, such as Beethoven's Fifth Symphony is transcendently beautiful, are normative. Beethoven's Fifth is not merely being described in this statement, it's being evaluated, of course rather positively. Similarly, consider the following prudential norm. If you want to pass the test, you ought to study. This ought is one of prudence. It is a piece of advice concerning what you should do if you have the goal of passing the test. In last week's vocabulary, this is a hypothetical imperative which tells you how to accomplish a goal you may or may not have. It is not unethical to not study, it is simply not prudent. Norms of etiquette, such as waiting for everyone to be served at the table before eating, or wearing a certain type of outfit or uniform at work, are their own distinct types of norms. It isn't unethical to eat before everyone is being served. It is just a bit rude. Legal norms are more interesting in that sometimes legal norms, in the form of laws, express moral norms. Laws prohibiting murder overlap the legal and the moral sphere. However, if a law is misguided, it may very well aim to express a moral norm, but fail miserably. For example, laws which allow slavery or are oppressive in various other respects are often mistakenly seen by the people who pass them as expressing moral norms. Remember, on the moral realist view we have adopted for this course, an individual, and indeed an entire culture, can have false moral beliefs. Hence, the mere fact that an action is legal does not entail that it is moral. So there's a distinction between these two types of norms. Okay, let me flip slides. Okay. All right. What happens when various norms come into conflict? Vaughan points out that one important feature of moral norms is that they are overriding. In other words, when a moral norm comes into conflict with either a norm of prudence, an aesthetic norm, or a norm of law, one should follow the moral norm. Consider a clash between a moral and an aesthetic norm. Aesthetics has to do with beauty and evaluating the quality of various types of art and that sort of thing. Now, what if someone were to make a video game with the best graphics ever designed, but had a plot which involved running over homeless people and beating prostitutes? Of course, I'm talking about a real game, Grand Theft Auto. Now, actively participating in a game in which one acts out doing these horrible things, beating women and harming the homeless, is arguably unethical. Even though it's imaginary, it just kind of puts you arguably in an unethical frame of mind, especially when you take into account you're kind of playing but yet participating in these actions. So, actively participating in a game such as this, it's arguably unethical, especially when the people playing the game are children and young teenagers who are still forming their basic view of the world. Now, if it is indeed unethical to act out the behaviors depicted in Grand Theft Auto for sheer entertainment, then the fact that the game is fun to play or aesthetically pleasing doesn't justify playing the game. The moral norms simply override the aesthetic ones. Similarly, if it is both prudent and unethical to cheat on a test, you shouldn't cheat on the test, even though doing so might benefit you, which is what I mean here by prudent. If a law endorses an unethical norm, then the law should be overturned. Another proof that moral norms are of overriding significance is that we are justified in punishing persons who violate moral norms. Just think of our whole justice system. This wouldn't be the case if these norms did not have much weight. So in contrast, we don't really punish people, and we shouldn't, for violating aesthetic norms. So no matter how ugly the sweater is your aunt bought you for Christmas, she certainly doesn't deserve any kind of punishment. Similarly, a person could violate many norms of prudence, so they could go about their life in an irrational manner. But again, you might feel bad for such a person, but they certainly wouldn't deserve any kind of formal punishment or anything like that. But moral norms, when those are violated, they're of such great significance that often punishment is justified. So that just goes to show that the ethical, one reason it's so important to pay attention to, is that out of all the different types of judgments and evaluations we make, the ethical evaluations are kind of at the top of the heap in terms of significance. Okay. Not only are moral norms dominant over other norms, they are also universal. Universality is actually quite hard to define. The basic idea is that the same ethical norms apply to everyone. If it is wrong for one person to steal just because he wants something that is not his, and we're assuming not for basic survival or something like that, then it is wrong for everyone to do so. Universality entails that moral norms do not vary from culture to culture or from person to person. The claim is not that everyone actually agrees about what is ethical and what is not. The claim is that there are such things as moral facts, and these same facts apply to everyone. Anyone who accepts that there are such things as basic human rights accepts universality. Similarly, anyone who accepts moral facts, such as it is always wrong to torture another person just for enjoyment, accepts universality. So if you remember back in the first couple of slides, we distinguished between the normative and the descriptive. Now, descriptive terms, they describe the world as it is. So is very much the case that people disagree about ethical matters. But that it doesn't follow that there are no universal moral norms, for the simple fact that moral norms are about how people ought to behave, not how they do behave. So, just looking back at the example we just mentioned, let's say you accept that if someone thinks it is okay to torture another person just for enjoyment, that they're wrong about that, or take any other egregious harm someone might commit on someone else. No matter what harm you choose, there's probably someone in the world somewhere who thinks it's morally acceptable, but only the moral realist, the person who thinks the moral facts are objective and apply to everyone, can say such a person is wrong about what they accept. This kind of presupposition, or this idea that people can have true and false beliefs or false beliefs on a moral matter, that's what enables us to engage in moral argument. If believing a moral claim simply made it true, then of course there would be no room for argument. People just couldn't be wrong about such things. So going back to last week's lecture a little bit, that's one of the reasons that we're proceeding in this course on the assumption that there are such things as moral facts that matches how we're actually going to be behaving. We're going to be disagreeing with one another and kind of debating issues amongst ourselves and with the authors of the various texts. Okay, now on to question 1D, which regards impartiality. Ethical norms are also impartial. Impartiality is closely connected with fairness. The basic idea is that everyone's interests should count the same. It is not morally permissible to make exceptions in what is allowable for various persons unless we have a good reason to do so. The text provides an example of favoring one type of person over another in a manner which does not violate impartiality. Impartiality does not dictate, for example, that we should cast an actor such as Tom Cruise in a role which is only suitable for a black or African American actor. It is not discriminatory to not cast Cruise as Martin Luther King Jr., for example, precisely because there is an objective reason not to, which has to do with being faithful to the historical reality. A decision to not cast any white or black people for a role, in contrast, would be a violation of impartiality because there is no good reason for such a prohibition. So again, impartiality is treating people differently, favoring one group over another for no good reason. Okay, now, another feature of the moral life, besides trying to achieve a level of impartiality, is that living ethically involves reasoning clearly about ethical matters. When we engage in ethical reasoning, we put forth reasons, either in defensive or against pursuing a particular course of action. In order to see the need for giving reasons for one's ethical convictions, Vaughan describes the case of a person who asserts that physician-assisted suicide is always wrong, but refuses to give a reason for her view. Now, I asked you to put into your own words why asserting moral ideas without offering reasons in support is problematic. The basic idea is that our ethical convictions are concerned with issues which are both very important and affect others. To say that even a person in extreme pain with no help of recovery should not be allowed the assistance of a physician in ending their misery is to state something of great importance to persons who find themselves in such a predicament. To not have reasons for such a conviction would be careless in the extreme. A mere appeal to one's feelings or hunch about the issue, instead of giving well thought out reasons which take into account how persons in such a position in society as a whole would be affected by physician-assisted suicide, indicates a fundamental lack of concern for those in such a position. Transitioning once more. Let's now look at the connection between reason and compassion, which will enable us to kind of get at the issue of how our emotions ought to affect our rational considerations regarding ethics. Okay, so the process of discerning morally relevant considerations for and against an action can be both greatly aided by and greatly hindered by the input of our emotions. We often experience strong morally relevant emotions such as anger, sadness, disgust, thankfulness, or sympathy when confronted with a variety of situations. Sometimes these emotions help us make well-informed decisions and are hence an aid to discerning right and wrong. For example, when we are confronted by a person in great need and we feel compassionate towards them, this can be a powerful motive to become more informed of why they are in the circumstances they are in, so that we can skillfully offer aid. The medical profession itself is largely motivated by compassion for the sick and suffering. The study of medicine and the application of medicine to specific patients is most proper when it is guided by the emotion of compassion. Now, there is of course a flip side to the fact that emotions can cause us to think harder about a moral issue than we otherwise would and take reasoned moral action. Sometimes emotions cloud our judgment. Vaughan notes that the emotional reactions we have towards various persons and actions can be colored either by our own psychological needs or biases, which have been ingrained in us by our culture and experiences. So, for example, if one is taught that poor people are poor because they are lazy at a young age, one might develop feelings of revulsion or disgust toward such people. These feelings would then make it hard to accurately assess why various particular persons are in poverty and respond accordingly. By making a sincere effort to state reasons for our convictions, we can challenge our own emotional responses to situations which may very well be clouding our judgment. Just putting those two thoughts together, when our emotions are connected to reason properly, they're helping us become more aware of relevant moral facts and having a higher level of concern for the people affected by various circumstances and actions. But if our emotions kind of override our rationality, so we have prejudiced, which means to prejudge, prejudiced view, then our emotions are kind of hindering our ability to assess reasons for and against an action. So Right? Proper emotion, properly trained emotions, I should say, are a great aid to moral decision making, and more kind of erratic or uncontrolled emotions can be a great hindrance. Uh-oh. Here we go. Now, uh, switching topics again. Future reading questions are going to be a lot more focused than these. This is, again, we're still in this kind of general introduction to ethics phase. But you'll find, even starting next week, that our discussions will become very focused on a much narrower range of topics. So don't be discouraged if you feel like if you're getting a bit of a flood of vocabulary. And it is a little annoying that this lecture and reading jumps around a bit. But then again, we're trying to do something that's rather impossible, which is give a bit of a crash course in ethical theory. But that's okay, because again, as we go through future sets of questions and topics, we'll be applying this vocabulary over and over. Hence, throughout the course of the semester, you'll have a better understanding of the meaning and application of these terms. Okay, but we are making another transition here. Now I would like to introduce you to an important philosophical distinction regarding the nature of duties. This is the notion of a prima facie duty or obligation. And this is usually a distinction. The distinction usually is made between prima facie and what is called ultima facie, or all things considered, duties or obligations. So basically, a principle states a prima facie duty only if we should obey that principle unless we have a good reason not to. For example, consider the specific moral principle that one should not lie. This is usually true, but there are obvious circumstances where this principle is overridden by other concerns. If telling the truth in a particular context could endanger someone's life, then the duty to preserve life will trump the duty to tell the truth. In the next few pages in the relevant text, Vaughan discusses 4 important principles which guide much of our reasoning in matters of medical ethics. These principles only generate prima facie obligations, precisely because these principles often entail conflicting advice, and this forces us to decide which principle should be given precedent in a particular case. And you'll actually, it might sound a little abstract now, but you'll see that over and over again as we get into the more specific issues. Okay, now what comes next is we're going to kind of articulate 4 principles of ethics that are especially relevant to medical ethics. And these are the 4 principles we're going to be making the most use of as the semester goes on. So it's very important to leave this lecture with a pretty decent understanding of these principles. Okay, so the principle of autonomy states that persons with the rational ability for self-governance or self-determination should be allowed to exercise this capacity. In plainer English, the principle states that people who are capable of deciding for themselves should be allowed to do so. It is easier to understand this principle if we take into account the kinds of actions which would violate the principle of autonomy. In a free society, freedom of speech flourishes. Freedom of speech is an important dimension of autonomy. Merely disagreeing with what someone is saying does not justify restricting the person's ability to state their thoughts. A right to autonomous choice also entails a right to be fully informed concerning matters which affect one's own well-being. This plays out in medical contexts in relation to the need for informed consent. Before a patient agrees to a specific medical procedure, she needs to be informed of the likely consequences of that treatment in comparison with other treatment options, including, of course, no treatment. Without this information, her capacity to make a rational choice, and hence her autonomy, would be limited. Like all four of the moral principles that we'll be discussing here, the right to autonomy is a prima facie right which can be overridden in various circumstances. So sometimes it is permissible to override a patient's decisions. So here's a controversial example, but it kind of illustrates the point. Arguably, a patient with a serious and contagious disease should be compelled to tell his or her sexual partners about the illness. Now, this involves a restriction on autonomy. If you reveal information a person doesn't want you to, you've definitely violated their autonomy. But doing so may very well be justified on the grounds that lives may be saved, given the specifics of a certain situation. So there we have a clash between the principle of autonomy and a principle we're about to discuss. Actually, a principle we already have discussed, a principle of utility, which involves kind of taking into account the good of everybody affected by an action. Okay. We have arrived at a discussion of a principle which is arguably the most fundamental principle in more medical ethics. The principle of beneficence states that we should do good to others and avoid causing them harm. Indeed, part of the Hippocratic Oath for doctors, which dates back to ancient times, is a stated commitment to above all do no harm. Even during times of war, doctors who are committed to this principle will tend to the wounds of the enemy soldiers who have been placed in their care. If a murderer is rushed to the emergency room, the healthcare workers will do their best to heal him or her, indeed have a duty to not let the moral failings of the patient influence the care the patient receives. One can distinguish between two separate but related duties in relation to beneficence. A principle of active beneficence is one which states a duty to go out and actively advance the welfare of others. Principles of non-maleficence, in contrast, merely prohibit the deliberate harming of others. In the context of healthcare, medical professionals are bound by both principles. The whole point of the profession is to actively promote health and the prevention or removal of pain. We don't expect doctors to merely refrain from harming us. We expect, more active beneficence, that they would actively come to our aid. Oops. All right. We will now revisit a principle which we discussed last week. This is the principle of utility, which forms the foundation of the theory of ethics known as utilitarianism. If you recall, this principle states that the right action to take, and here we're dealing with act utilitarianism, is the one which produces the most overall benefit and least harm for all persons affected by an action. One way to better understand the theory of utilitarianism, which we covered last week, is to note that the utilitarian sees the principle of utility as not merely prima facie. For the utilitarian, utility is the final authority on moral matters and cannot be overridden by other factors. Now, a more plausible approach to ethics, such as the one we are taking, balances the principle of utility with other competing principles. So, for example, in healthcare contexts, utility competes with autonomy, justice, and beneficence, which we're discussing, even if harming a patient were to enable a doctor to help another patient or patients, such as in our island scenario from the discussion board. Doing so would violate beneficence for sure, and autonomy as well, if the harmed patient were not informed of what was going to take place, so she could give consent. Having said this, we use the principle of utility to make decisions in medical care quite a bit. The most obvious area of application is in the formation of basic healthcare policies and laws which govern insurance. At present, defenders of Obamacare usually defend universal health care on utilitarian grounds. The claim is that more overall benefits and fewer harms will come to U.S. citizens if everyone has affordable access to care, in comparison with the relevant alternative of them not having access to care. Similarly, insurance companies use the principle of utility to help decide which treatments should be covered by various policies. We simply can't afford to have access to any and all possible healthcare treatments, hence tough decisions need to be made in regards to rationing. If a procedure is both expensive and yields little benefit, then the principle of utility dictates that something else should be covered instead. Okay, so just a quick review of what we've just stated. Even though beneficence and the principle of utility are principles centered on avoiding harm, the principle of beneficence, both active and passive, are only concerned with the well-being of the patient. So, in contrast, the principle of utility concerns the well-being of the patient and other people who are affected by that decision. So, in much healthcare situations, beneficence is the dominant principle. The doctor is usually only concerned with the best way to help his or her patient. But again, when we look at the need to develop general healthcare policies and laws, and once we realize that the scarcity of medical resources and the price of those resources are relevant factors, then it's easy to see how principles of utility, both act and rule utilitarianism, are relevant to which laws to write, which to reject, which policies to accept, which sorts of procedures to cover or not cover on a more broad level. Hence, each of these principles has its own role in regard to how we actually go about making medical decisions. Okay. The final principles we will consider involve justice. Most generally, justice simply means fairness. In a just system, people receive what they deserve to receive. Hence, in a just philosophy class, each of you will receive the grade you earn by completing work of varying levels of quality. In a just legal system, those who have actually committed crimes are the person who actually end up convicted, and the sentences fit the crime. This is known as retributive justice, which is the fair meting out of punishment for wrongdoing. Retributive justice actually has little application to healthcare contexts, since doctors are bound by beneficence to try and benefit all patients, criminal or not. Another important type of justice, however, is distributive justice, and this concerns the fair distribution of society's advantages and disadvantages. Healthcare is one of the many societal goods, and the access various persons have to various levels of care is an issue of distributive justice. Should everyone be guaranteed the same care? Should everyone be guaranteed the same minimum level of care? Should the government play a leading role in distributing these goods by regulating insurance, or is this a matter for the private sphere or the market? All of these questions have been at the forefront of this country's discussions over the past several years, and will continue to do so. Okay, so we've ended this week's coverage of our reading questions. And again, just the first 2 weeks, you have received a lot of vocabulary to digest, and things really do become more focused next week and onward. So if you're a little perplexed by the volume of new terms and vocabulary, relief is coming. We will be looking at specific ethical issues in a much more focused way going forward, but it is good to have this more general background to bring to the table. Okay, so good talking to you again. Wish this were a live class so we could kind of interact, but you know, sometimes you need to do things online to fit people's schedules. So good talking to you this week, and talk to you next week.